Hi, good people.
Hi, good evening, good morning, good afternoon.
Whichever time you are watching us. This is the Midwives Reality Show.ke. My name is Evelyn Gewa.
I'm Mary Guru.
Today we are back to you people. Please subscribe to our channel, share and comment, and leave a suggestion.
There,
Yes.
there.
Yes,
You guys,
yes.
you're not leaving suggestions these days.
Please
We are back.
comment. Yeah.
Any improvements? Anything you want us to discuss?
What
comment.
you want us to improve on? Please
Yes.
Tell us. Yeah. So
if you're doing well, just say you're doing okay.
Well, yes. So that we can know we are moving together. Okay.
Yeah.
So Mary, today we are going to do a different topic. Yes. There's something that has really disturbed mothers after delivery, and especially those who are breastfeeding.
Sure.
And today we are going to tackle about how to manage cracked or sore nipples. I know this is a nightmare to most of the mothers who have breastfed, but today we are going to let you know what you are supposed to do.
Evelyn.
Yes.
Well, you know when you mention about sore nipples.
Yeah.
Or cracked nipples. How many years? You take me how many years back? You
cracked nipples. Cracked nipples.
Yes.
Or sore nipples, as the name suggests, they can be something.
My hair even has stood up. Just thinking of that cracked nipple. It's an experience that I had.
So at least you should be telling us what you felt.
Yes. It's that soreness. And literally your nipple getting a sore.
A wound.
Yeah. After you breastfeed.
After breastfeeding.
And mark you, I was a
first-time mother.
When I was a first-time mother, and I was still a midwife.
You're still a midwife. Yeah.
So it's a challenge to many.
Exactly.
Regardless of your status.
Regardless of your status.
I didn't know that breastfeeding can be such
an issue.
A
big role.
Yeah, I just used to see you give a mother a baby and she puts on the breast.
And it's automatic that the baby breastfeeds.
Yes, but I didn't know the pain that it can inflict on a mother.
Remember, when we were talking about some of the things that come with challenges that come with breastfeeding, cracked nipples was our number one. It was our number one. So today we decided to just tackle it as a topic so that we can bring you closer to how you can cope with it, or in case you get it, how you manage it, and sometimes
and how also to avoid
to prevent it.
Yes.
Yeah. So Mary, maybe when you had told us that cracked nipples is the soreness. Then I know it must be very painful.
It's very painful.
It must be very painful.
Especially when that baby cries and you think you're going to put her on your breast.
Yeah. It's a challenge. It's a challenge. Yeah. Yeah. So Mary, now that you know it is painful, it's a wound that is on my nipple. Can it get? Anybody can get it, or it is specified?
I told you I was
a first-time mother.
I was a first-time mother.
Yeah.
A midwife. So your profession doesn't matter.
Exactly.
It doesn't choose who you are.
Yeah.
But the main thing is how you attach your baby.
Exactly.
On the breast.
So the key thing is the positioning of the baby.
The positioning. The
latching of the baby on the breast.
Yes.
How am I supposed to latch my baby on the breast? Although we had tackled it on our breastfeeding video that most people watched, it is good you also go back to that video and watch how to position a baby during breastfeeding.
Sure.
Is there anything we can tell our viewers, even though there is that video, some key points during the breastfeeding position or they can remember?
Maybe you can just go through a few.
Yeah.
You remember this position? The football position.
Exactly. That is used mostly for twins.
For twins, like you can hold both of them like this.
Together, yeah.
And then you make sure like you've put the whole
black area, the whole nipple.
And the black area.
And part of the black area on the baby's
just to be very precise, let me show you from our diagram here.
Exactly. Let me help you.
Okay. There.
This is our breast.
So this is our breast.
I don't know whether it's clear. Let me hold it for you.
Oh,
Yay. Sorry, people.
Fine.
Yeah, it's clear now.
It's clear.
Yeah.
So what we are saying, this is the nipple.
Yeah.
And part of here is part of the areola.
It's the areola.
Yes, here. Where you can see these are the milk ducts.
Yeah.
You can see?
The milk bags.
The milk bags, yeah, or the ducts.
Yeah.
So if you give the baby this one, they end up hurting you because it only gets up to somewhere just hard to the hard palate.
Yeah, to hard the hard part of the palate. Eh?
Yeah, that is the part of the mouth.
Yeah.
But if you put up to somewhere here, there,
yeah,
the duct will be squeezed, so the baby will be getting enough milk.
Exactly.
And your nipple will be safe.
And it will be resting on a softer part of the palate.
And then now this one will go further to the mouth, to the soft, what we call the soft palate.
Yeah.
That is the far end of your
mouth. Yeah.
Yes.
So done?
Done. So for mother's close cradle, you remember?
Yeah.
This way.
That is the mostly used.
This is the mostly used, yeah? Where you put the nipple, the application of the nipple is the key point.
Regardless of the position.
Regardless of the position.
Exactly.
How you fix the nipple plus your areola.
Yeah.
The areola is the other part that is not
the black area.
The black area of the
the nipple.
Of the breast,
yeah,
yes.
The breast, yeah.
So we did several positions.
Yeah.
We may not go one by one, just to mention those are the footable and the close cradle is the most used.
Mostly used, yeah.
Yes. So you just look for the position that works for you.
Exactly.
Yeah, sometimes also it's good to learn when your baby wakes up, you learn the pattern. The hunger pattern of your baby.
Yes.
Because when the baby wakes up and the baby is very hungry, they tend to be very cranky.
Yeah.
And they tend to latch on the nipple before they don't open their mouth wide.
They tend to suck whatever comes into their mouth
very fast.
Yeah, they capture very fast what comes to their mouth, and it might be the breast, the nipple at this time, and then they keep. So learn your baby's pattern. So
before the baby, when you start seeing the baby is waking up and eating the fingers, before the baby start crying, please change the baby and put on them and start feeding before the baby becomes very clanky.
Exactly. So that they can do it softly without any issues. So you are telling us, we were explaining about the key point. You keep changing you go for the position that
you love
most, or the one that works for you. And then another key point is even if you have the cracked nipple, keep feeding. Do not stop feeding. I know that might be controversial because of the pain, but keep feeding because it helps with the healing.
Sure.
True. It helps with the healing of the nipple. Now we are going direct to the point that we had explained, we had prepared for you today. And Mary, what are some of the self-help tips that we are going to talk to our viewers today? For example, we had said we should not use the plastic-made breast pads. Why do you think so?
Plastic-made breast pads, what happens, they don't absorb a lot.
Yeah.
And anytime you have a sore nipple, they tend to, they'll soak into that pad.
Yeah.
Remember, if the absorption rate, probably you are pouring a lot of milk.
Yeah.
And then you tend also to sweat on top of the milk.
Yeah.
So that makes it wet.
Yeah.
And just as we said, the cracked nipple, when it becomes wet, there is risk of getting more
cracks.
More infection.
And then infections.
Yes.
So you ensure that you get the absorbable maternity pads and not the plastic made ones. Please, when you're going to buy the plastic pad, the breast pads, it's good also to check the one which is good for you. We had also talked about what brassiere a mother who has cracked nipples should wear. One, it should be cotton, should be made of cotton.
Still because of absorbability.
The absorption part of it. And then another thing, as Mary had explained, one of the self-remedy is proper attachment of the baby. When you attach the baby properly on the breast, we are good to go. Then you also supposed to, those pads that Mary had talked about, the pads of the breast, change them.
Change them frequently.
Frequently as much as possible so that you avoid the wetness. Then you keep feeding the baby, as we had said. Avoid nipple sheaths because most of them are made of plastic. Avoid nipple sheaths so that we can be away from them. Then from there, what are some of the things that we can do when we already have them, the cracked nipples? And you can, for example, Mary, I have a cracked nipple, okay? And I'm here feeding the baby. How do I manage? How do I manage that breast nipple?
First, we said you should not stop breastfeeding. Why? Because you would get engorged if you stop breastfeeding.
Exactly.
And also you would make your baby a bit lazy.
What do you mean by getting engorged?
Engorged means your breast may get full, and once they are more full, they get harder.
Exactly.
So even now, the latching that was to be easy becomes
an issue.
Yeah. So, but anytime you realize like you have engorged breasts, first do manual expression
of the breast milk.
Just to soften. Just to make sure that the nipple and the areola becomes softer. And remove that excess milk so that the baby can be able to latch on
the nipple properly. And after that, after
breastfeeding, you express. And around the nipple, the affected nipple,
the cracked nipple. That is the point I wanted you to
the cracked
explain.
nipple. You can clean with warm water. Then apply expressed breast
milk. So once you're done,
then you air dry.
Exactly.
Air dry meaning just allow it to dry by the
allow the milk to dry.
Yes.
Allow the milk you have applied on top of the breast nipple to dry. Do not add more water on the.
Yes.
Because now that milk, one, it sterilizes your breast nipple. Two, and it moisturizes.
And it has its own antibodies.
Which will help in the healing of the wound. Okay. Then secondly, there are some of the lanolin. If there's what do we call it?
If you can afford.
If you can afford that, is it
the lanolin?
The lanolin, 100% lanolin, not any other chemical. Just apply.
Yes.
But a question comes after the lanolin. Do I clean the lanolin before I feed my baby?
Lanolin is safe.
It is safe for breastfeeding.
That is why we are saying go for 100%
lanolin. Yeah. Go for 100% lanolin cream. Okay. Then after that, you can now keep the nipple dry.
Yes.
Keep the nipple dry. After you keep the nipple dry for the next feed, it will keep healing. Slowly by slowly, it will keep healing. Now, we have some remedies. We had talked about them as points, but we are now summarizing the whole thing into like remedies. For example, our first one is a warm compress.
Yes.
But remember, our warm compress here will help us both for decongesting the milk. And then, after that, it has been decongested, I have fed my baby. After feeding my baby, I now apply the milk and leave it to dry. That is true?
Very true.
Number two, we have proper positioning of the baby. These are just a repeat of what Mary had said. Position the baby, feed the baby properly. After the baby has been fed properly, rub the milk again on the breast, take the baby to sleep, and then leave the place dry. Then there's a point which is a bit controversial about salt. There's a salty water rinse. A salty water rinse, it is when the wound is so bad.
Yeah.
When the wound is so bad and it needs a lot of, maybe the water rinse, the salty water rinse will act as a dressing. It's a normal saline on its own. So you just rinse the area with the water. The water that has salt, and it helps the place to dry and heal. Then you feed your baby more often. That is well said, and it is self-explanatory. Then there's a point that we need our mothers to understand. Now, Mary, when I want to unlatch my baby from my breast, how do I go about it? Do I just pull the baby out of the breast? What do I do? Please tell our viewers.
Yes, like when we are viewers, you remember when we did if you go back to our other video,
yes,
we said hand hygiene is very key.
Exactly.
When breastfeeding. I know people may wonder, but Mary, you know, I'll not hold even the tip of the breast. I'll just put the nipple in the mouth and the baby is able. No. It's always good before you breastfeed, wash your hands with soap and water.
Yeah.
Then after that, you know your hands are very safe for the baby.
Yeah.
So when you want to, like, sometimes to unlatch or to remove the breast, probably there's something has caught you, or baby is dozing off,
or you need to attend to something and you are in the middle of breastfeeding.
So what you do, it's either you pull the chin down, the chin you pull down a bit, and the baby stops.
Exactly.
Opens the mouth, and then your breast is free. Because normally the breast it's usually fixed at the palate higher. The other one is you can use your small finger and you slide it in the mouth of the baby
from the side.
Exactly. And the baby is left with your finger, and your nipple is free. So what are we saying? We are saying the best latching position saves you from
a cracked nipple. And good at latching technique will save you from cracked nipple.
Yes.
So latching is key here.
Latching is key.
Latching and unlatching.
Yes. So if you have issues with latching, who do you consult? You consult your midwife. Consult your lactational manager. Whoever is near you, or a healthy practitioner who is familiar with lactation.
Latching and lactation.
Yes.
There are people who have really learned about lactation as a profession.
Yes.
It is good you follow so that you get the best guidelines about it. Now, having done that, our last part is about some of the things to avoid when you have cracked nipples. I know some people will have so many myths according to where somebody is, about how to manage the cracked nipples. Some people will tell you to put what?
Some people will tell you to put some tea leaves,
some cow dung. Cow dung, even soil. Just to make sure that
on a breast and the baby is going to feed, or even cow dung.
No, it's not right.
Or some herbs. Yes, the wood may heal, because there are some herbs that may heal.
But where is the hygiene?
But is the herb even safe for the baby?
No, this baby is very small.
Is the herb even safe for the baby?
Imagine.
So if we can only do the right things, people get the right and the proper guidance, it will take us a long way.
Some people also are guided especially in our setting. I know where we live and where we stay, buying drugs over the counter is something very common. So you might go with a cracked nipple and
you are told this is
the best drug. When you look at it, it has so many chemicals. Please watch what you use on your breast, and especially the cracked nipple.
Yes.
Because whatever is being applied on the nipple is being transferred to the baby, because the baby is going to suckle. We've said the ointments, avoid all ointments, not unless it is 100% lanolin. Yeah. Apart from that, I think we've mentioned almost everything.
Apart from that, mothers, I'm just here to talk to you.
Yeah.
As your own midwife.
Yeah.
All what I have to say is that proper latching technique.
Yeah.
Utilize the few hours, the few minutes you are in the hospital.
Exactly.
To run the right procedure.
Make use of your midwife before you leave the hospital.
Yes. Yeah. Let it gauge how well. It's not about you, it's about both of you.
It's about both of you.
Are you able to breastfeed?
Exactly.
So that when you go home, you are safe and your baby is okay, and also you are okay.
And remember, when you're breastfeeding, it's a challenge to everybody. If you feel like you have a challenge with breastfeeding, don't do things just because you're supposed to. Ask.
I know people right now, currently, with the modern world, you'll say, why suffer? I can use
Google or YouTube.
None. No, none. I stop breastfeeding.
No, please. Breastfeed the baby.
Breastfeeding is key.
Yeah.
Breastfeeding is key. However hard, it's only that probably you are learning, the baby is also learning.
Yeah.
So with time, given time, both of you will be at par.
Yeah.
And you'll both do so well.
Exactly.
Don't give up.
We had talked mostly and at large about what is good for us and why do we need to breastfeed our babies.
Sure.
Breastfeeding, breastfeeding, breastfeeding. That is if you're supposed to breastfeed.
Breastfeed, breastfeed. If you have any issue with breastfeeding and you're watching our video, you can kindly contact us. Our numbers are down on the video, down there.
We are here to help you.
We are here to help you.
Yes. And we'll
breastfeeding is not something probably you can do online.
Yeah.
Breastfeeding need one-on-one.
It's an art. You need to work on it.
Yes.
Work on it.
So guys, we wish you all the best as you breastfeed our newborns.
Please breastfeed our babies. We want to see them healthy, like our baby. Nana. All the best and see you in the next one. Bye.